To highlight about why is oral health care important, especially to our patients who have autism. Okay, prevention is better than cure. I will always emphasize this to my patients. Although we have all the specialists and all the facilities, infrastructure to provide treatment for our patients, we always emphasize on preventative care, the daily oral hygiene care. It is important to recognize that these patients, they are at high risk of developing oral diseases. And why is this? Is because difficulty in practicing and maintaining optimal oral hygiene care, because of difficulty in getting cooperation, compliance, and motivation. Some of them also experience motor deficit, where they have a delayed fine motor skills development, and as Dr. Ilham mentioned just now, some of them have difficulty gripping the toothbrush. So she has already mentioned ways on how you can actually modify toothbrush. What are the alternatives that you can use in order for them to undertake toothbrushing activities? And the other thing is because of drug-induced gingival overgrowth. Some of them experience epilepsy or seizure, so they are being prescribed with anti-epileptic medications, and it can cause side effects such as this. And when patients have gingival overgrowth, they are very scared to brush, because when they brush, it will bleed. So they will stop brushing. But then this gum overgrowth will become worsened. So we have to always emphasize on the importance of regular toothbrushing, okay? Because if they stop brushing because of this overgrowth and bleeding, the overgrowth can become even worse. So this can be controlled with good oral hygiene care, and if it's too severe, we will refer it to our gum specialist colleagues to have a surgery to remove this excessive tissue. Okay, but at the same time, patients still have to maintain good oral hygiene care, otherwise the gum can grow again. So the other thing is because the use of medications, syrup medication especially has high sugar content, and it can cause caries such as this. So caries can develop on the outside surface like this, or it can also happen on the tooth surface itself. So that's why Dr. Ilham emphasized so much on brushing on the tooth surface and also on the outer surface here, because this is where food tend to accumulate. The other thing about medication is that the side effects of medication. For example, some patients take risperidone or olanzapine for mood stabilizer. Some of them also take antidepressant, anti-anxiety, and these medications can cause dry mouth. And what can dry mouth cause? It can cause caries and gum disease such as this. So this is caries. Gum disease, you can see this gum around the teeth is a bit reddish, yeah, and also like bengkak, inflamed. Okay, patients can also get this dry red fissured tongue. So this is when Dr. Ilham emphasized on the importance of tongue brushing, because if the patient have fissured tongue like this, it is easy for the bacteria to harbor or to grow in between the lines here, and this can cause halitosis or bad odor or smelly breath. So that's why, in addition to toothbrushing, you should also encourage your child or whoever under your care to also brush and clean the tongue. Okay, oral ulcer can also happen because of dry mouth, and the other one is a fungal infection that can happen because of dry mouth. So as I mentioned, some patients with autism also have epilepsy or seizure or sawan. So they are being prescribed with anti-epilepsy, and they can experience gum enlargement. And this can also cause their permanent teeth to delay in eruption. And the other side effects of anti-epilepsy is also low platelet, we call it thrombocytopenia, or leukopenia, which is low white blood cells. And when you have low platelet, there will be risk of bleeding. And when you have low white blood cells, there is risk of infection. So in order to at least reduce the risk of bleeding, especially when you get overgrowth gums like this, always make sure maintain oral hygiene care. Otherwise, the gum will continue to grow, and it can gingivitis can happen where the bleeding will become worse. Okay, and if you maintain good oral hygiene care, so there will be less probability for you to get oral infection. So the other thing about patients with autism is that Dr. Ilham has mentioned that they like to keep their foot in the pocket in between their cheek and their gums. So you can see if your child is like this, so there is a possibility that there is food there. They like to hold it there because it gives some kind of sensation that they like. So Dr. Ilham also has mentioned about how you can clean this area. So make sure when you do toothbrushing, make sure you clean this pocket area as well. So look at the patient inside the mouth, and look at not just the teeth, but also all over, especially that area, okay, in between the teeth and the cheek, because this is where the patients always like to keep their food. Okay, and the other thing about dietary habits among autism patients is snacking behavior, meaning that they like to eat food frequently throughout the day. Like most of us will only eat like 3 or 4 times a day: breakfast, lunch, dinner, tea and dinner. But for these patients, they like to eat like a bit and frequently throughout the day, and this can actually predispose them to developing problems such as caries or KVT, and also gum disease. Okay, patients with autism also is reported to have selective eating. Because of sensory hypersensitivity, they have high demands for low texture food. So some parents like to blend their food. So when patients eat blended food, it tends to stay in the mouth, okay, because it has low clearance. So when it stays in the mouth, it can cause problems such as caries and gum disease, and also bad breath, or bad odor breath. And of course, preference for sugary food, because when patients have dry mouth especially, and they have altered sensation or altered taste sensation, so they tend to put more sugar in their food. So this can predispose them to oral diseases.